Hi, everyone, and welcome to your first lecture on wellness. My name is CJ Potter, and I'll be taking you through today's content. What we're going to focus on today is how wellness can be viewed as a healthcare approach for the 21st century. So, when we typically think of healthcare, we might think of doctors and hospitals. However, we're going to challenge that and we're going to add in this concept of wellness and look at how it can interplay with our well being. Now, before we get started, I do want to make it clear that these lectures are structured in a way to add to the textbook content. So I'm not going to be reviewing the same material that's in the book. That being said, in order for you to be most successful on your quiz this week, I strongly recommend that you both review this lecture as well as refer to your book for all the important information. All right, let's get started. All right, so first let's go over the outline of today's lecture. In order for us to talk about how wellness is a modern approach to healthcare and our healthcare concerns, we're first going to start by looking at the traditional medical model that has been developed. Once we understand how our current system functions, we'll take a few moments to kind of talk about some of the issues that system has created for us. And that leads us into talking about how wellness can address some of those major issues created by our traditional approach to healthcare. And that leads us into talking about the wellness model that we use for this class, and that is the basis for the wellness assessment that everyone's taken. Ready? Okay, let's get started. Now, to start by reviewing the traditional medical model, we can go all the way back to the Middle Ages. And in the Middle Ages, contagious diseases, such as the plague, were major threats to individuals as well as the communities they lived in. As a result, the average lifespan was approximately 49 years old. Now, eventually, science started to identify those germs, called pathogens, that were making people sick. And once they were able to identify them, they could work to treat people with the medicines designed to eliminate those pathogens. That's the approach we still use today. When people become sick, we step in with the medicines and treatments they need to recover. Modern medicine is far more advanced, and nearly any infectious pathogen that can be identified can be treated. Currently, in the United States, the average lifespan has stretched out to about 77 years old. So, with that, we have some of the most advanced and highly talented medical professionals and procedures in the entire world. We do an unbelievable job helping individuals when they become sick. We even make TV shows about the miracles that sometimes occur within these hospitals. But if we have the world's most advanced healthcare system with the ability to treat nearly any pathogen, what's the issue? The problem is that we're no longer affected necessarily by infectious diseases. Present day Americans are plagued with chronic health issues that are caused by our lifestyle behaviors. And that includes things like our diet, the stress we face each day, and our levels of exercise, etc. Now, once we become ill, people are able to prescribe different medications to address some of these issues. But why wait until we become sick? It's not until recently that medicine has started to ask that question and look at different things that might keep us from becoming ill in the first place. So let's take a closer look at how the traditional medical model has impacted the shifts in the United States. On the left hand side of the slide, you'll see a list of the top causes of death from the year of 1900. Now, looking at the list, you'll see multiple different issues that could easily be addressed with some of the modern medications that we've developed. Now, look at the right. If you take a look at the list on the right hand side, you'll see a lot of issues there that don't necessarily have a specific germ or virus at their root cause. However, we still have medicines that might help address certain issues that we have. They might not be able to remove those pathogens, but they might make life more manageable for somebody with that condition. So our problem is our lifestyles are no longer primarily affected by infectious diseases. We're plagued by these chronic health issues that are caused by our lifestyle. But if this is the only way we know how to handle health, we just keep waiting for people to become sick. And then once they are sick, then we look at see what kind of pill or treatment we can give that person to help remove that sickness. And what we're doing is we're artificially lowering people's cholesterols, etc., helping them try to get back on the right track. Well, all of these medications are very advanced and very expensive. And it's not just the doctors who think this way. In fact, many part of the general public in the United States believe that if they go to the doctor and see their physician, they're going to give them whatever that person needs to be healthy again. And that's not necessarily the case. We're more so just managing these issues that exist. And so that attitude doesn't take account all the different little things that person did to become ill in the first place. And so it took a very long time for society to stop and ask, why do people have to become sick before we start helping them? So if we're assuming that we're not currently sick, then we are healthy. But being healthy isn't just about not being sick. So let's take a look at a list of the most common chronic issues affecting Americans. Besides each disease, in red I listed the total annual cost associated with that disease. When you add all of our country's healthcare costs up, we find that we spend about $7,500 per American, and that's whether they're healthy or not, on medical care. Chronic or preventable diseases accounts for about 75% of all of those healthcare expenses and almost 75% of all deaths each year. That makes the United States one of the worst countries in the world for the occurrences of chronic diseases. Now, fortunately, we have a medical system that gives us one of the highest survival rates in the world, but that means people are living a long time with some of these chronic issues. So not only are these rising healthcare costs a bad news for the overall national economy, they're devastating for different individuals. For instance, on average, insurance prices have doubled for most employees. In addition to that, almost 1 million families per year declare bankruptcy as a result of different medical expenses. So instead of waiting for people to get sick and then finding what we can give them to manage that disease, we need to flip our mindset towards prevention. Because when we focus on our lifestyle and we think about ways we can live well, we can prevent up to 40 million cases of chronic disease. And with that comes over $200 billion in savings within the next few years. And so those are just direct costs, but when you account for things like productivity and less sick days taken at work, we're talking about almost $1 trillion impacting our economy. Otherwise, those national expenditures are going to continue to rise until they reach about 4.3 trillion by year 2020. And that makes healthcare expenditures nearly 1/5 of our overall GDP or economy compared to the 1960s when the nation spent about 5% of its overall GDP on healthcare. So, to really paint a vivid picture, we can take one of those chronic issues and explore a little bit further to look at both the direct and indirect costs. For example, heart attacks have become increasingly common in our society. Now, unfortunately, when people experience these devastating events, the recovery time can take anywhere from like 2 weeks to about a month, and that's just for you to go back to work. People estimate that the average cost of a heart attack is going to be about $760,000 over the next 20 years, and that's because people are going to spend on average anywhere between $38,000 to $50,000 per year on ongoing medications and treatments in order to manage their condition. And so, as you might expect, there can be a lot of negative side effects that linger as a result of that heart attack. And that can include people who feel more anxious, depressed, experience more muscle pain, a lack of autonomy. They can't do some of the things they used to be able to do, etc. Now, what's sad about this is that some of the issues that lead to the heart attack start developing as early as your childhood. And so some folks estimate that a heart attack can be up to 80% preventable based on some of the lifestyle choices we make. Most research is going to say anywhere from like about 60% preventable. And so this report by CBS News actually had a very high estimate saying about 80% of your risk for a heart attack could be prevented. So real quickly, we can bring that back to that total list of all the chronic issues we shared earlier. And you can see that although heart disease and heart attacks are at the top of the list, each one of these different conditions has their own story with their own preventability, their own issues and symptoms that people are going to deal with for the rest of their lives once they develop such a chronic concern. So once you start adding all of these little details up, it becomes much more important to focus on preventing these concerns from ever rising in the first place. Alright, well, this is pretty depressing content, and for that I apologize. It's not the happiest topic, but I think it's essential to shine a light on our current situation if we're ever going to take steps to improve upon it. So they say the first step is raising your awareness, and I hope at the very least we've taken that. Because the reality is, the World Health Organization reports that Americans spend more on healthcare than any other country. And ironically, we still have some of the poorest quality of health among those countries. So we simply aren't getting our money's worth out of our current system. The point is, there's a major mismatch between what our healthcare system does for us and what our needs really are. Although we do have some of the best survival rates and the most advanced healthcare system, maybe waiting for people to get sick and then treating them with those expensive treatments shouldn't be our go-to solution. And maybe we can have another way to help prevent some of those concerns. And this is just a really quick chart to kind of illustrate some of those points I just made. You can see on the curve here a relationship between your life expectancy at birth as well as the total annual expenditures on health costs in US dollars. And you can see that a lot of countries are on the left side of this chart where they don't spend a lot of money and their life expectancy varies. But there are a lot of modern countries who spend very little on healthcare and still have very high life expectancies. In fact, higher than the United States. We mentioned that our average lifespan in the United States is about 77 years old, and you can compare that with the fact that we spend on average $7,500 per American per year on healthcare. And this is where we would fit in on this chart. Now, hopefully, we'll start to see this shift. For instance, before you signed up for this class, had you heard the term wellness before? Because since about 1990, the federal government has gotten involved with this wellness movement and has started the Healthy People Initiative. So in 1990, they set a list of different goals and objectives for the nation as their overall level of healthcare. And each 10 years, we've updated that to try to better ourselves. And so now we're on the third iteration, or Healthy People 2020. And with that, we have a few dozen topics as well as thousands of objectives that we're working towards as a country. And that comes down from the federal government, and different departments and organizations take those objectives and work to implement them in their communities. And so I've listed here some of the overarching goals from Healthy People 2020 that will give you a better idea of what we're trying to work towards. And so that's when we start talking about wellness. And wellness is an older term going all the way back to about the 1940s. So it's much older than the Healthy People Initiative that started in 1990. But after World War II, the World Health Organization defined health as more than the mere absence of disease, meaning that we can't simply remove germs and bacteria and that will make someone healthy. But the problem is that directly contradicts how we traditionally approach healthcare. So instead, by focusing on wellness, we're looking at health promotion and progress towards higher functioning, higher levels of energy, greater levels of comfort, and integration of the mind, body, and spirit. And that can look different for each individual person. So we all got to find our own way to pursue this. There are a few things that are universal. So, for instance, diet, exercise, having a sense of social support. Those are things that all people will benefit from. However, what that social support looks like, or what that proper diet looks like, or exercise routines might vary based on each individual. And so 70 years later, we're branching outside of those core concepts and really trying to understand this whole process. And one of the main issues is if you left today and you asked people around campus or in your community what being healthy is, many of those people would still say that it revolves around not being sick. And we know that it's much, much more than that. And so we want to address all of those chronic health issues that Americans are experiencing and those lifestyle behaviors that cause those diseases from a wellness perspective. Because if we can just reduce some of those behaviors, we can cut our risk for chronic health issues by at least 66%. And that cuts your hospital visits by 33%. And that makes sense to us because we know quitting smoking or drinking less alcohol is good for us, but why aren't we able to do it? I think it's going to be focused on not quitting certain things, but what things we should be doing. Being very proactive and healthy is what's going to make us live longer, healthier, happier lives in the long run. So, one of the main myths that we want to bust with the traditional approach to healthcare is that it's not dichotomous, it's not black or white. You're not either healthy or sick. Oftentimes, we find ourselves somewhere in between. And that's what research suggests. They think wellness exists on a continuum with many different shades of gray between being well and being not well. For instance, you could think of it like a car. And when you're doing things that promote health, maybe you're moving forward. However, if you're doing certain things that might lead you towards sickness, you might be moving in reverse. Now, if we're not doing anything that leads us to illness, but we're also not doing anything that leads us toward improved health, we're probably just sitting in neutral and we're not moving forwards or backwards. And how often have we felt like this? That we're not upset or sick, but we're not especially happy or satisfied either. So, this class is about busting out of neutral and moving you to more satisfying and higher quality of life. And it's not necessarily someone who's strong and brave, successful, or whatever who's going to be well. We're talking about people who've figured out ways to increase their quality of life and their life satisfaction. So take a second to look at this graphic here to get a better idea of what I'm talking about. On the left hand side, you see that people who have increasingly severe issues with their health are moving closer and closer to premature death. Now, with the traditional approach to healthcare, we address a lot of those issues, but that kind of only gets us back to neutral. It gets us back to zero. And so, in order to be healthy, we have to take steps intentionally to move us closer and closer to higher levels of well being. And that might be increasing your awareness, learning how to make some changes, but then actually pushing yourself to grow and develop. And when we do that, it might take a little bit of effort, but we're also increasing how happy we are in our day to day lives, uh, as well as our physical health. So now, if we know at least a few of the core concepts that make people healthy, and we've been pushing these healthy people initiatives since the 90s, what's slowing us down? Why haven't we made more progress? And I think that's a great question. There is a lot of political and economical pressure on keeping the system the way it is. For instance, we shouldn't be forcing people to make certain healthy decisions. And there are a lot of companies out there that sell products that aren't necessarily healthy. We can think of like maybe the fast food organizations, etc., that say you shouldn't limit the size of an individual soda or how often they supersize a meal or whether or not they even have the choice to supersize a meal at some of these chains. Uh, but also, the healthcare industry lobbies to kind of keep things the way they are as well. And so there's a lot of business and money to be made in working on curing some of these different diseases. And the prevention aspect undermines those efforts. And so pharmaceuticals, as well as healthcare and organizations representing healthcare professionals, spend millions of dollars lobbying Congress to keep things somewhat the way they are, to keep things moving in the current direction. And that makes this prevention based movement much more difficult. Here are a few figures that might help you understand what I mean when I say that these industries are lobbying our lawmakers in order to kind of keep things the way they are. One of the ones that was surprising for me specifically was learning that the American Medical Association is actually against guaranteed or universal health care for all citizens. Now, depending on how you phrase this, you get different levels of support from the American people. For instance, guaranteed health care is something that a lot of Americans really support. But when you switch that term and you call it socialized health care, you lose a lot of that support that you had. And so that phrasing is something that the AMA has lobbied for, as well as interest for private insurance companies, pharmaceutical reps, and just general lobbying by the healthcare industry, and the billions and trillions really of dollars that have been spent in the past few years in order to kind of shape what healthcare is going to look like in our country. So, where are we making our progress? The wellness message is being pushed mostly through our society by different employers and companies that are learning that they can save a lot of money by preventing these issues in their employees. So, by investing in healthier employees, they're specifically reducing their insurance costs, saving them a lot of money. And even insurance companies are encouraging this, noticing that they can save money by encouraging all of their members to go see the doctor sooner and more often, and not just waiting until they get sick. And so that costs these insurance providers and these employers a little bit of money now, but it saves them a lot of money later by identifying these chronic issues earlier or by preventing and lessening their impact at all. For instance, one study found that by investing $10 per American in prevention could yield significant cost savings. Specifically, it would be around $7 billion dollars a year in Medicaid, Medicare expenses, as well as about $16 billion dollars in total healthcare spending. And that's just for $10 per American. And so, what are we specifically investing in? Well, instead of looking for the germs and bacteria that make people sick, we're investing in salutogens. It's the counterpart to pathogens. And these are the aspects of health that promote well being. And these are the aspects we're going to talk about in this class. But we're seeing more and more of these employers offering discounts for, let's say, gym memberships, organizing social events like happy hours, and other ways where they can promote healthier lifestyles in order to not only save themselves money, but promote higher quality of life in their employees. Now, we don't believe you need to wait until you're employed with some organization to start thinking about these concepts. College is the perfect opportunity to look at your own lifestyle and ways that you can make improvements that make you happier, improve your quality of life, and save you money. And that's interesting because traditionally, college students often don't consider this because it's just not a priority. Typically, college students are very healthy, and taking a second to consider whether or not a bad habit really is important is something that we don't think about right now. We kind of put that off for the future. And so, a lot of the non traditional students in our class, who often already have these jobs, or students returning to OSU later in life, experience even greater outcomes because they kind of recognize that these changes need to be made. And so, thinking about these changes when you're 18, 19, or 20 years old uh, can really make a huge difference down the line. You think about like investing just $1 a day, but 5 or 10 years later, you have a significant amount there. And so, developing good habits now can lead to a longer, healthier life, where those bad habits can start making you sick uh, immediately, right? And so research shows that a lot of signs of those chronic issues that we talked about are already present in college students. We just don't realize it yet. We don't necessarily feel it, but they're there. And so that includes like high and chronic stress, which might not be a surprise for a lot of folks. Osteoporosis, some signs of that due to like poor nutrition and exercise among college students. They've found evidence for high blood pressure, cholesterol issues, increasing rates of disability, and the list goes on and on. Some of the things that are most popular that might not be a surprise include like alcohol and binge drinking, smoking, etc. But the main reason is that we naturally have this present bias where we're not concerned about what happens tomorrow. We're more concerned about today. Okay, and so we'll always, and sometimes we'll sit and we'll think to ourselves like, no, that's an issue I'll fix later. I can have some fun today and I'll pay it back later. And that's kind of like a credit card. But we know that if we don't start paying that back, that really adds up and it gets out of hand very quickly. And that's something that's starting to happen more and more to these college students. And that's why college campuses, including Ohio State, have created their own wellness centers and their own wellness models to help their students live healthier lives. And that's exactly what they're doing. So hopefully we can talk a little about OSU's model, which we use for this class, and how we might approach living healthier, happier lives here at OSU. So here is the wellness model we're using in our class, and it's OSU's wellness model that they promote in the Student Wellness Center and the RPAC, and it's also the wellness model that's the basis for the wellness assessment that you take for this class. And so when we look at this, there's the 9 different domains, and to read them off really quickly, you have your cognitive, your physical activity, spirituality, creativity, emotions, career, financial, social, and preventative self-care. And these all combine to improve your overall level of well-being, life satisfaction, and your physical health. And so we didn't just pick 9 different domains. Each domain uh, has been linked to increased and improved health and life satisfaction through research. And so that research suggests that by doing or focusing on at least a couple of these, you can make a significant impact in your overall level of happiness and health. All right, so let's wrap this up. In summary, wellness is much more than just taking some medicine or receiving a vaccine. It's not just something that you can have a prescription of and move on. It's a way to live your life all day, every day. And research shows that not only will this make you a healthier individual physically, it's going to improve your quality of life and your life satisfaction. Now, if you want to go a little bit further, here's a few challenges that you can consider for the week. First, you could always go to your favorite news source and you can kind of peruse the articles there and see how many of those relate to a healthy lifestyle or health in general. You can kind of reflect on how the articles that are there, or the fact that there are no articles, if you don't find any, kind of shapes our view of health and what makes us healthy. In addition to that, if you'd like, you could always think about an activity that you really enjoy doing and take it one step further and really consider why you enjoy that activity and how that activity influences your overall wellness, and start thinking about some of those underlying processes. Others, you might want to take a few minutes and consider some of the chronic illnesses that people in your family have had to deal with throughout the years, and look at some of the different lifestyle things that you could do that would either prevent those or some of the things that might be leading up to some of those issues. But in general, what we're promoting is individuals just being more intentional about their health, specifically by focusing on wellness. So think about what makes you happy and then be happy on purpose. Be well on purpose. Okay, so I hope this works. If there are any questions, feel free to shoot us an email. Otherwise, good luck on your quiz, and we'll see you here next week for the next lecture. Take care. Bye.